Alton Memorial Hospital, located at 1 Memorial Drive in Alton. Today we are here celebrating the renovations to the Women's Health and Childbirth Center. So welcome to this grand event. First of all, I'd like to thank Alton Memorial Hospital and all the physicians and staff for their membership. So Alton Memorial Hospital, thank you for your membership. And thank you for investing in this facility, which also enhances our community. It is my pleasure to introduce Mr. David Brosh. He is going to do some introductions and tell us a little bit about this beautiful renovation here. So do you want to start with introductions?
Okay, why don't we do that first? But first of all, I want to welcome everybody that's here today. This has been sort of a day we've been waiting for, and in fact, Jessica, the manager of the unit, reminded me a few days ago that it's been 9 months. And so now we're here. And I think what you'll see is just phenomenal, the great work that has been done. The staff, I think, does a great job with the care they provide. Hopefully Jess will give you some stories about some of the things that have happened here over the last several months as this has been going on, so to speak. It's been kind of a challenging time, but I think go forward is everything's going to be great.
Right.
So why don't we go around and kind of introduce, we have board members, our foundation board members, department chairs, etc. So let's do some introductions.
Okay, Monica, let's start with you, please.
Monica Bristow, RiverBender Growth Association.
Dave Bryant, Foundation Board.
Jessica Mossman, manager of the Women's Health.
Yeah, I'm nervous.
It's okay, it is your baby.
It is my baby. It was 2 years of planning to get here. Manager of the Women's Health and Childbirth Center.
Just start again.
Okay, my name is Jessica Mossman, and I'm the manager of the Women's Health and Childbirth Center.
Art Williams, Vice Chairman of the Foundation Board.
Joanne Adams, I'm a Foundation Board member.
Jeff Turner, I'm the chairman of the OBGYN staff.
Steve Thompson, chairman of the Alton Memorial Hospital Board. Brent Walker, mayor of Alton.
Brad Gocher, Vice President of Operations for Alton Memorial Hospital.
Rusty Ingram, Director of Business Development, Alton Memorial Hospital.
So between Dave, Mr. Brosh, Jessica, there's a really cute story about how you name your wings in here. Jessica, do you want to tell us a little bit about that?
Well, our wings are named after the sisters who founded the hospital in honor of their parents. So we are standing in the Smith entrance, and then we will travel where the OB expansion is down to the Olin wing.
Wonderful. Mr. Brosh, anything else about the renovations, all it took?
Well, first of all, I'd like to thank lots of people,
Yes.
because it took lots of people to get here today. First of all, I think just our BJC HealthCare and our Alton Memorial Health Services Foundation have really been the ones who have funded this project. So we've spent over $2 million in this sort of renovation and expansion of our OB area, labor delivery, postpartum, etc. So it's been, as Jess said, a long time coming. We've been in the planning process for a couple of years, and then in the construction process for about 9 months. But really, I think there's been many people involved in that process. Hellcamp Construction was sort of the lead group here who really managed that. Locally, we have Perry Hartwick and Ronnie Greenwood, who are in our plant facilities department, and so they're obviously coordinating all those efforts with Hellcamp, etc. We had Sean Gillum from BJC Construction and Design, who was here in working with our group, local group in Hellcamp. We had Tom Barr from the Lawrence Group. We had Murphy Mechanical, Kane Mechanical, and Wegman Electric. So a lot of local contractors here putting in time across the board on this particular project. So I think the reason and the why we're here is because we have seen our deliveries grow substantially over the last several years. So about 5 years ago, we were a little south of 400 deliveries on an annual basis. Last year, we finished north of 700. Almost double the number of babies being born here at Alton Memorial in the last 5 years. And that's not because more babies are being born in our community. It's because more moms are choosing Alton Memorial Hospital to deliver their babies. And I think that's a testament to the great staff that we have here. Last year, we finished in the 99th percentile for patient satisfaction. So that goes a long way for when it comes to moms choosing a place to have their babies and start their families. So Again, I would like to thank everybody who's been involved in all of this, everybody who's had a hand in it and been in the planning and the design and the construction, you name it, across the board. So,
Those are great thank
Thank you.
yous. Thank you for sharing that. Jessica, anything you'd like to say about the center?
Absolutely. I can echo everything that Dave already started. And I was thinking about preparing my speech for today when last night, about 5 o'clock, so as I'm preparing for today and thinking last minute, I got an email from a patient who delivered here. And it was wonderful. A wonderful thank you, mentioning several of the staff members that are in the room today. So that was great. But what it really got me thinking is BJC and Alton Memorial, we're already lucky. We have great technology. We are combined with a health system that's fabulous. And so we have many fingers out, technology fingers, advanced health, wonderful physicians that work here already. But what it made me think of was the everyday people too. So 28 babies last year were either flown out or driven out by St. Louis Children's Hospital and transferred to a higher level of care. So we have the resources that it takes with the transport team here on site to take care of those babies. So what an amazing asset, right, to have that in your pocket. But then beyond that, 700 women delivered here. So 700 families received the great care that our staff provides. 700 families received the best education, consistent information. Because of our partnership with Baby Friendly USA that we received education from with a grant that we applied for and received from the Illinois chapter of the American Academy of Pediatrics. 700 families learned about safe sleep for their babies, and with that a gift from our White Cross Auxiliary that was a sleep sack for every newborn to go home with. We had 125 families come through our childbirth education series classes, which is an amazing number. And with our expansion and renovation, we were able to, because of the Dorothy Roper Fund, the Westside donation, family donation, and the White Cross Auxiliary, we were able to fund our new classroom, which is beautiful. And more families are going to be able to come there to get the education that they need. So all of these things, so while I could hype on the greatest technology, the latest thing, we've had that. But what we do really well is we take care of the everyday families and the things that they need. And that's why I think more families are choosing to come here, and that we've had 700, and now we have room to take care of up to 1,000 new families who want to be here because we do the best job right.
That was some great information. So many things to be proud of.
Right.
I think what you'll notice that, which I think is really special and unique in a sense, is you're standing in the original hospital lobby. So the Smith Building is the original hospital built in 1937. So we're really mixing sort of the historical, kind of the old with the new state of art. And as you go through the facility, you'll notice all the, really great technology that we have available to us now through, all the electronic connections with Children's Hospital, et cetera, you name it, we've got it. And with the children's transport team being here on site, with their mobile NICU and their copter, I think that's a huge benefit to all the families in our community. So I would the other thing I want to mention to you, which is kind of interesting, and as you kind of do the tour through the facility, please be respectful. Evidently, lots of moms decided to deliver babies in the last 24 hours, so we got a full house. So again, really go out and spread the word, because I think we've got something going special going on here.
You absolutely do. Monica, as president of the Chamber River and Growth Association, any words?
Just like to thank you for your continued investment in this building, this physical building, and in the community. You do a wonderful job, and more babies to come. Let's just keep them happy.
All right, thank you.
Mayor Walker?
Just piggyback on what Monica said, it's wonderful for you to invest in our community. And based on what you heard today, the #1 rankings are earned. They approved the numbers. We have a state-of-the-art facility with a wonderful staff here. You can't get better care than anywhere in this hospital in Alton. Alton Memorial does a great job. And it's showing in your numbers, the #1 rankings, the amount of people that choose to have babies here. Just keep up the good work, and thank you for investing in our community.
Thank you, Mayor.
Way to go, Alton Memorial Hospital. Congratulations. Okay, we're going to cut ribbon. All right, 1, 2, 3. Go ahead and cut.
Hi, I'm Dave Brosh, president of Alton Memorial Hospital, and we're here celebrating the grand opening of our new Women's Health and Childbirth Center. And we have really put a lot of time in design of the space and the look and the feel of the space throughout the last probably at least 9 months, as we've done detailed planning and a lot of work and construction in some of the what I would call the original hospital building, and then moving into the Olin wing where we currently had our operations for labor delivery postpartum, and that was completely renovated and redone.
My name is Jordan Holm. I am an RN here at Alton Memorial Hospital, OE, and I'm in our new triage unit. So this is a triage room that we have here. We have 3 rooms back here, and our triage unit allows for patients who may not necessarily be in full-term labor, just need to come in and get checked out for various things. We can triage them back here. We have 3 rooms that allows 1 nurse to take care of 3 patients at one time, and then if you are in active labor, we can move you to one of our new labor rooms. But this area is very beneficial to kind of prevent patients from having to share rooms, privacy, and then if in fact of an emergency, these are up-to-date, newest technology stretchers that can be broken down to actually have deliveries back here.
Hi, I'm Jessica Mossman, manager of the Women's Health and Childbirth Center here at Alton Memorial. I am standing in our new C-section prep room. And we're really excited about this room. This gives us the opportunity to welcome new mothers who are preparing for a scheduled C-section in a room that's very comfortable. In this room you can see that we have added some touches, like a beautiful piece of artwork by Drs. William and Janice Robinson. We're beautiful. And then we have disguised some of our medical necessities. So behind this panel, and you'll see it in the other rooms as well, we've hidden all of our medical gases, so we have all the equipment here that we need to take care of you and your baby, and we've covered it by a piece of artwork, which we're really excited about, because for the little piece of time that we might need it, we don't want to look at it all the time. While you're here, your nurses will get you prepared for your C-section. They'll talk you through any of your fears, and they will make sure that you are extremely comfortable.
I'm Lori Fassler. I'm the OB nurse clinician, or basically that means that I'm the patient educator and staff educator for the Women's Health and Childbirth Center at Alton Memorial. We are standing in a postpartum room. Previously this was a triage room. It was a semi-private room, and in the renovation they helped us make this into a comfortable postpartum room. After about 2 hours after the baby's born, you move into a room like this.
Hi, my name is Renee Stromat. I am an RN at Alton Memorial's Women's Health and Childbirth Center. We have our grand opening here tonight, and I am just showing off one of our brand new labor and delivery and postpartum rooms. I just wanted to start with showing you one of our warmers. So this is where after the baby has had some time with mom skin to skin, we bring the baby over and we'll clean baby off, make sure baby is doing well.
Hi, my name is Cindy Brown, and I'm an RN CLC here at Alton Memorial's newly renovated OB department. This is our nursery, where we would have to bring a baby that needed a higher level of care. That would be called a level 2 care. A baby in here could be on oxygen, IV fluids, antibiotics. If we had to separate them from their mom for a time, we could take care of them in this room. If they had to be transferred to a higher level of care, this is where we would do all of the work necessary until the transport team got here.
The cost of the total project was just north of $2 million, and part of that, $700,000, came from our local Alton Memorial Health Services Foundation, and the other $1.3 million came from BJC HealthCare. So with all that being said, I really would like to thank the Riverbend Growth Association for being here with us to celebrate with our ribbon cutting and all the things that they help support us with during the course of the year, as we do a lot of work to improve the health of the people in the community that we serve.